Karl, welcome to the program.
Thank you very much. Glad to be here.
It's great to have you on. So, to start off, let's get an overview of MTBC.
MTBC is a leading provider of cloud-based healthcare, IT, and support services. We've been at this for over 20 years, including providing electronic health records to physicians and medical billing services, and provide services in every state across the country.
So what's your background? How did you get into all this?
Yeah, it's a good background. Started out with a master's degree in health administration, went on after a few years to start my own physician management and billing company, and about 3 years ago joined forces with MTBC. So was looking to hitch my wagon to a brighter star, and haven't looked back since, and having a lot of fun at it.
So I know we're here to talk about the Talk EHR initiative. This is the project that you're heading up. So how and why was Talk EHR created at MTBC?
Well, one of the things that MTBC and our physicians, and we see it with physicians across the country, is that electronic health records have taken a real toll on the provision of quality medical care. Obviously, the documentation of services being provided is critical, but with the advent and almost requirement of electronic health records, physicians are spending more time in front of a computer than they are patients, and we wanted to change that.
So what differentiates Talk EHR from some of the other solutions that are similar out there?
So there are many, many EHR programs out there, and what really makes us different, and we think is a game changer, is the fact that Talk EHR simplifies the documentation process and the revenue cycle that physicians need to have in order to provide healthcare services efficiently. So it's really driven by interactive voice, artificial intelligence, but even beyond that, we made great efforts by studying physicians that we provide services for and their practice patterns. We made efforts to make Talk EHR easy to use. In fact, one of our early adopters, a lovely physician out of Arizona, commented to me the other day that it's cut our documentation time in half.
So I want to get into that a little bit more. Can you tell me about that interactive voice and artificial intelligence and why that's a key differentiating factor?
Yes, so much like talking to Siri on your iPhone or Alexa on your Amazon devices, Talk EHR incorporates Google Voice, and it allows the physicians to not only navigate the electronic health record by using their voice, but also to dictate into the electronic health records without using add-on software packages. And it really just streamlines the process. The artificial intelligence piece is kind of the second half of that. So Talk EHR learns based on not only the activities of individual physicians, but from physicians across the country. They're able to take physicians' practice patterns and to be able to suggest and to be able to help them work through the documentation much faster. Not making clinical decisions for physicians, but it is helping them kind of queue up the next step in the documentation based on learning.
So Karl, as the person heading up this initiative, what's the marketing plan? How do you plan to roll this out?
So the marketing plan, overall, the strategy was to provide Talk EHR at no cost to physicians. So it really and truly is free, but MTBC and Talk EHR offer a number of add-on services that generate revenue for the company. So where the electronic health record is free, the back-end services, the medical billing, to put it simply, is there at actually a very competitive cost for physicians. And the way the software is designed, the information flows through the system, through the electronic health records into the practice management software, and makes the billing just much easier than a physician would normally have to go through. So how we monetize this is by selling those add-on services.
And where can our audience go and find more information about the company and Talk EHR?
So to find more information about MTBC itself, the parent company, simply go to mtbc.com, and there's a tremendous amount of information on there, including an investor relations page. But if you'd like to take a look at Talk EHR itself, you could go to talkehr.com, and there's a tremendous amount of information available there.
Karl, thank you so much for joining us today.
Thank you for having me. Pleasure to talk about MTBC and Talk EHR revolutionizing the way physicians provide healthcare.
We have Nish Sampath from MTBC. Nish, welcome to this SNN Live.
Thank you very much, Robert.
It's great to have you on. We just previously had Karl Johnson on to discuss the Talk EHR initiative. Now, for this portion of the interview, we're going to have you talk a little bit more about the Enrollment Plus initiative. But first, let's get your background. How did you come into all this?
Yes, thanks, Robert. So my background is in computing science, and I've worked in the healthcare technology space for the past 18 years, very specifically in the healthcare integration space. So I manage the EDI division of MTBC, which is responsible for operating our claims clearinghouse and now our enrollment clearinghouse, which is titled Enrollment Plus.
So let's get into that a little bit more. What is Enrollment Plus? And what is the Enrollment Plus clearinghouse specifically?
Great question. So Enrollment Plus is a SaaS-based integration service. It's built to process, translate, and audit electronic enrollment messages for the insurance industry. So for example, when someone buys a long-term disability plan through their employer's insurance broker, the electronic message that is sent to the insurance carrier to enroll that individual would pass through Enrollment Plus. Enrollment Plus translates the message based on the requested format, validates certain data elements within the message based on our proprietary rules engine, and provides reporting and analytics back to the relevant parties so that they can make informed business decisions. We recognize that with our claims clearinghouse concept and what the claims clearinghouse has essentially done for to improve the healthcare reimbursement industry, we said, hey, we can parlay that experience with our claims clearinghouse, Claims Plus, into the development of a similar solution for the insurance enrollment space. And currently, the industry is plagued with many of those same challenges that they face with respect to healthcare claims processing, and we're going to bridge that technology gap.
Mm-hmm. So you touched on my next question already a little bit, but maybe we could get into it a little bit further. Why did you develop Enrollment Plus, and also when, and what's the market opportunity?
Absolutely. So we've been working on Enrollment Plus for about 18 months now, and our team of EDI experts, and I should say EDI stands for Electronic Data Interchange. Our experts have been working in the insurance enrollment space actually since 2008 with various clients. And during that time, we found that certain industry-wide challenges are simply not being addressed by today's insurance enrollment and integration solutions. So the first challenge is scalability, where each benefit vendor who has to connect independently to each insurance carrier they do business with. It's very, very costly to do that. The second challenge is onboarding speed, where the average time it takes to develop each of these electronic integrations is almost 90 days for new employer groups. And that inefficiency often forces an insurance carrier client to send the initial enrollments via paper. And of course, the third challenge, which we're focused on fixing with Enrollment Plus, is support cost. 30% of the electronic insurance enrollments industry-wide result in insurance carrier staff having to do manual data remediation work due to poor data quality. So phone calls, meetings, faxes, emails, very old school ways of doing business. So through our work with the Claims Clearinghouse, we had identified certain process-related lessons that we're now able to apply to the insurance enrollment space. And using this model, we're able to be a disruptive force in this expanding market, especially at a time when more and more of the industry moves towards electronic versus paper enrollments.
So who is the target market, and what were these clients or your potential clients doing before Enrollment Plus existed?
Yeah, absolutely. So, since the role of Enrollment Plus is to facilitate electronic transactions to the insurance carrier, our target market for Enrollment Plus is anyone who transacts with the carrier along with the carrier themselves. So that would include insurance benefit vendors, third-party administrators, and the insurance brokers who deal with employer benefits, such as worksite and voluntary products. So Enrollment Plus is not targeted at the individual consumer who is directly purchasing a policy from the insurance carrier, for example, for home or auto insurance policies. And to your second point and second question, prior to Enrollment Plus, each benefit vendor or broker or TPA would have to connect independently to each insurance carrier, using those traditional EDI gateway solutions that they would have to staff, support, and manage, which of course adds to bloat to their operating budgets. And as previously described, it leads to a host of industry challenges that significantly impede their ability to scale cost effectively.
So Nish, what's the differentiation factor between Enrollment Plus and what's currently available?
Yeah, great question. It kind of starts back when we started to develop the product. We began by having a significant discovery period where we engaged in dialogue with key members of major insurance carriers, benefit vendors, and other knowledge experts in the industry so that we truly understood their day-to-day challenges. We then actually created an ad hoc advisory council of these experts who help us to drive the design of Enrollment Plus. And at each step, we engage with these experts to ensure we continue down the correct path. So we're truly solving the industry's business problems. We believe we built a technology that delivers value to everyone involved in the insurance enrollment workflow, where traditionally the solutions that were available to insurance carriers did little to improve the workflow of the benefit vendors and related groups they deal with, and vice versa. Both the carriers and benefit vendors obviously see this as a significant advantage as it now improves and strengthens those key relationships. Also, we have self-service functions and business intelligence capabilities within ECH that is a big driver for clients. Having the ability to understand the health of their enrollment business with the click of a mouse is very appealing.
So Nish, in the business model for Enrollment Plus?
Right. So our revenue model for Enrollment Plus is based on the per employee per month concept, which the insurance industry is very familiar with. We charge a small fee for each enrolled individual within Enrollment Plus during a given period. Our SaaS model allows us to scale very effectively with minimal incremental cost. And since we have direct relationships with the insurance carriers, we don't have to pay the intermediary charges, which are common in the claims clearinghouse market. So when you consider that most major insurers have many millions of covered lives, even if we facilitate the insurance enrollment for a percentage of those lives, you can see how this number can quickly add up to become a substantial source of recurring revenue for MTBC.
So Nish, where can our audience go and find more information about MTBC and Enrollment Plus?
The best place to go is www.mtbc.com.
My name is Robert Kraft, and I'm your host on this SNN Live newscast. Again, joining me has been Nish, Sampath, and Karl Johnson from MTBC, publicly traded company with the symbol MTBC. Thank you, and thank you, Karl, again for joining us today.
Thank you.